So we have all discussed and we all know about scarring on the donor area when it comes to hair transplant. We have talked about it, how to minimize scarring, scarring in FUT, scarring in FUE, scarring in punch grafting. But have we ever discussed about scarring on the recipient area after a hair transplant? Hello friends, my name is Dr. Gaurang Krishna. I am a hair transplant surgeon at Medlinks, New Delhi. Today in this interesting video, we'll be discussing about scarring that can happen on the recipient area if your procedure is not executed properly when it comes to a hair transplant or a hair restoration surgery. Whenever the skin is cut, there has to be a scar. We have heard about these terms called scarless hair transplants and so on. We, being ISHRS members, cannot use these misleading terms like scarless, painless, or needleless hair transplants. So, scarring is a part of hair transplant. But scarring happens on the donor area. And that too, not a very visible scarring. If done properly, the scarring is not very visible, but scarring happens on the donor area. Today, I'll be showing you a case where the scarring happened on the recipient area, and we'll also be discussing why this could have happened. So let's jump into the case. Now, the case is of a young man around 28 years old who got a transplant done because of his receding hairline, and this is what he got. He would have got around 25 to 2800 grafts done, but the results didn't come out very nicely, which is one part. It can happen. So if the surgery is not done properly, the grafts are not taken out properly, or the graft's quality is very bad, or they were stored out of the body for a very long time, then or less grafts were implanted, then less density, or we call it suboptimal results, can happen. What was very disappointing in this case is the scarring. And as you can see the picture, the magnified view of the patient in the inset, you will clearly see these little white dots. These white dots are the scars that happened on the recipient area. Now, why would a recipient area scar? We have never heard of scarring on a recipient area. So the scars probably happened because the instruments that were used for implantation were very crude. Probably thick CHOI implanters, implanting pen would have used where the thickness was very large. Why a thick or a big size implanter was used? Probably because whoever did the surgery was not very well versed with the fine instruments, and probably that's why the cuts that were made on the recipient skin were too broad for the skin to heal properly, and thus scarring happened. And when scarring happens, not only the first transplant results go down, even the correction becomes very challenging, because when you are transplanting on a normal skin, soft skin which has adequate blood flow, then the results will be very nice. But when you are when you are working on a scarred area, for example burn scars, or any kind of diseases, scalp diseases which are causing scarring alopecias, or this kind of scarring which has happened because of a poorly done hair transplant, then your repair transplant also becomes very difficult, because the skin is not normal anymore. The blood flow has decreased, the skin has become tight. What we can do about such cases, that's the second part of this video. In the first part, we discussed about why the patient landed up with scarring on the recipient area, which does not happen very often, but when a procedure is done really badly, then even your recipient area can scar. So how we corrected that case? Now, there are subtle differences between a new procedure, a new hair transplant on a virgin scalp versus a transplant that is being done on a scarred skin. On a scarred skin, when we do a hair transplant, we make sure that we do not use epinephrine or adrenaline. We make sure that we are not going very high with density. We don't target 60 or 50 grafts per square centimeter. We go conservative. We also make sure that the finest possible instrument is used. Like in this case, we use sapphire blades because they are least damaging to the skin, and we are putting very thin hair graft. We are not putting very thick hair grafts, so that the skin is not further damaged. So this is what we did. We did a correction transplant for him using another 2500 grafts in the frontal area, and this is the result that we achieved after 9 months of his procedure. So you can clearly see the difference from here to here. This difference was possible through a corrective hair transplant that we very frequently do at Medlinks, because hair transplant has become very popular, and when something becomes very popular, the service providers also become a lot. So that's the unfortunate thing that is happening these days in this part of the world, that there are many people who are not well trained, not well qualified for a hair transplant, do not have the proper equipment, infrastructure, or the team for a good hair transplant. They are trying to do this procedure, and the ultimate sufferers are the patients. But even in such cases, repair, even though it will not be a great result, but still some repair is possible. So this is how the patient transformed over 9 months after a repair transplant that was meticulously planned, which was slightly different from your garden variety hair transplant, and thus the look was restored. This is another top view. As you can see, this entire area that was transplanted previously also but didn't come out well. The same patient with a scarred skin, when he got his second procedure done at Medlings, got a much better growth and now can go out with a confident head. So same patient in the side view. Again, if you see, you'll still see there the skin here is not normal because we cannot change the scarring that has happened. There's no, let's say, cure for scarring. Scarring will not go away. We can only hide the scarring. So this is what we have done in this case. And we have an interesting video. So we make sure to show our audience combing videos of our hair transplant result, because see, photos can be photoshopped. Photos can be taken after putting a lot of black powder, Topic, or other kind of hair fibers. But with these kind of combing videos, there is no such scope of any kind of cheating being done when we are showcasing our results. The whole idea of doing a hair transplant is that it looks nice, pleasing to the eye, even with wet hair, even in windy, atmosphere. The patients should not have to hide their scalp. They can move ahead confidently, they can move ahead freely, and that is what we routinely achieve at Medlings with our perfect eye technique. So the purpose of this video was, number one, to show that hair transplant is not a commodity. It's a proper surgery which requires a lot of skill, which requires great infrastructure, which requires a great team. And only when all these three things come together, skill, team, infrastructure, and of course care from the patient side, only then you get a great result. And in case you have got a transplant done which didn't turn out to be very well, there's still scope of improvement. Even in such cases where the recipient area has scarred, even to that extent, the procedure was done so crudely that even the recipient area had scarred, but still we have means, we have the expertise, we have the equipment to treat even such cases. So that was all, folks. That was the discussion about a failed hair transplant and how to correct it, scarring even over the recipient area. So if you have any further questions, please ask us on the comment section, and we'll make sure that each and every query of yours is answered properly. Thank you so much.